Asymmetry of the cheeks. Can it be corrected? I have no contour in the left cheek at all. The back portion of my cheek is flat all the way to the jawline. The right cheek has some lift and volume, but there is quite a bit of hollowness under this cheek. Can this be corrected, and can some asymmetry be achieved? I am open to surgical and non-surgical options.
Thank you for your question. You submitted your question without a photo, but you're basically asking, can asymmetry of the cheeks be corrected? And you described that your left cheek doesn't have much contour and it's flat all the way down to your jaw, and on the right side there is a bit of a lift, and you're just asking about surgical versus non-surgical options. Well, I can certainly help you understand how I approach the desire for cheek volume enhancement as well as the issue about asymmetry without the benefit of your specific photos. But certainly this is something we talk about a lot in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and helping people with volume deficit has actually been a significant rise in our practice thanks to the newer soft tissue fillers and newer techniques that are now available. So to help you understand first, what is the basic cause of the asymmetry? Well, the human face is naturally asymmetric, and it's naturally asymmetric because of the foundation of the face. And the foundation is the bone structure. And it is not unusual for one side of the face to be a little bit flatter than the other. So sometimes it's referred to as hemifacial microsomia, but really everyone has it to some degree. And so when we treat asymmetry, we're not fixing it, we're improving it. And how do we improve it? Well, this is what I was referring to earlier. The evolution of solutions has been significant since the days of my residency and fellowship training over 20 years ago to where we are today. Back then, we would basically start to figure out what's the best type of cheek implant to place and how to modify those cheek implants during surgery. Well, in the past few years, we actually have newer fillers that can actually last very long and allow for that benefit of longevity to avoid multiple frequent office visits, as well as what's even more important is the ability to control and to customize. Now, that being said, we use a technique called structural volumizing, which is very different from what is traditionally done with soft tissue fillers. Soft tissue fillers, by definition, is placed in the soft tissue. This means putting volume under the skin and trying to restore some shape. Well, very often, up to a point, it can have value, but then beyond a certain point, the face can look doughy and it can look a little bit pillowy. When we do structural volumizing, we're actually placing the filler at the level of the bone through special techniques and a method so that there's minimal bruising, if ever, and the material being placed at that level actually provides better structure. It creates this nice natural appearance as if you have more well-defined cheekbones. And this is something that has worked out very well. We use it for cheekbone enhancement, we use it for chin enhancement, we use it for jawline as well as jaw angle enhancement. And the change can be quite transformative, but at the same time very natural. So certainly there are, I think this was a way that I recommend typically to my patients when we have our initial consultation. I'm a cosmetic surgeon. There really is no limit on what I can do. Everything from almost completely non-invasive, such as the creams and products that we have for topicals, to more advanced cosmetic surgery. And so what I find is that having the knowledge of surgery and placement of facial implants and other bone type of procedures, whether it's fracture repair, reconstruction, etc., has been a huge benefit for my application of structural volumizing. So when I place these fillers, I find that our patients are extremely pleased with the outcomes. So whether it's an asymmetry, I can actually add more to one side compared to the other. Whether it's better definition, it is remarkable how effective this can be. And then with these long-lasting fillers, we're looking at up to 2 years of correction. So I think meet with qualified, experienced cosmetic surgeons who do a lot of injectables. A lot of times surgeons become so busy doing what they do, they actually don't do injectables. Since in my practice we offer a full service for everything from Medi-Spa treatments such as lasers and minimally invasive procedures to surgery, and I've always kept an open mind about not just doing a surgical solution for everything, but rather the most optimal solution. And a lot of times we're doing a combination. Sometimes we'll do eyelid surgery and combine it with injectable fillers for the cheeks. There's a lot of flexibility. And this is a very fortunate time to be in this field because we have all of these many, many options and different techniques to help our patients look better and have minimal downtime, which is truly the goal. In a modern world, no one has time. And so the less downtime, the better. And of course, you want to have really good, natural, predictable outcomes. So I hope that was helpful. I wish you the best of luck. Thank you for your question.